the science behind attraction, plus when to see a doctor if you notice changes in your body. Everything you wanted to ask about sex but didn't. Now you can ask Dr. Leah, sexual health expert and associate professor in the Department of Health and Human Performance. Here she is, Dr. Leah.
Thanks, Derek. It's great to be here today with all of you. I'm Dr. Leah Janine. We're here to answer your questions about sex and relationships. We have a lot of the latest research and a little common sense. Plus, we have a special guest here to talk about infertility. But first, let's take on some viewer questions.
A man says, how do the remote control toys work and do women really like them? I was thinking about getting one for my wife.
Well, it depends on the woman, but there are some things to consider, like your connection dropping or not connecting at all. With remote control vibrators, for instance, the signal can drop if Bluetooth can't continuously transfer information to the vibrator. If you're using an older phone, that could also cause a drop in connection. Another con here might be that the toy company may not be able to protect your privacy or data. Make sure that you know what data is being collected and how they're using it. You also might want to try out the toy before you give it to your wife to make sure it works and that it will connect remotely. Some remotes can be controlled by an app on your phone, usually through Bluetooth or sometimes Wi-Fi. Be aware of how far the toy is from the remote because that'll affect how it works. Sometimes you need to be close to the person using them, but others can be controlled anywhere around the world. It can be a fun activity to share with your partner and a good way to explore new experiences together. If you or your partner are excited about either having control or losing control, a remote control toy can be an excellent way to fulfill this fantasy. If you feel like your sex life is getting a little boring or routine, by giving up control when you're aroused, it can be a great way to experience some pleasure and add some spice to your sexual relationship.
Yeah, you can't be too intimidated by toys thinking it's going to replace you or something like that, right?
No, not at all.
Good. And so what are some good options, Dr. Leah?
The Zalo G-Spot Pulse Wave Vibrator not only vibrates, but it also warms as it pulses. It has 64 combinations and comes with a removable sleeve to use depending on how large of an area that you want to stimulate. There's another one that has an arm that vibrates inside of you while another massages the clitoris. You can control it with a motion sensing remote that adjusts the intensity. The remote control panty vibrator is just 3 inches long with 3 speeds and 7 vibrations that fits right in your underwear.
Okay, hold on a second. That sounds like everything here is for the girl. You got the Zalo G-Spot, okay, you've got the Lelo's Tanny 3, and you got the 3-inch vibrating thing on the underwear. Any kind of guy use some of these things? What can we do?
Well, I don't know if there's ones that are just for the male, but there's definitely ones that are for the male and female. So there's the Happy Rabbit penis ring, and this vibrating toy has 2 rings, one to slip on the erect penis, which is a larger one, that then fits behind the testicles. Plus, there's a pair of rabbit ears to massage the partner's clitoris.
Thank you very much for that answer. A viewer wants to know, what happens to the body when you're attracted to someone?
Let's start with talking about the difference between attraction and lust. Lust is the desire for sexual gratification and comes from our need to reproduce. The brain will send signals to stimulate the production of the hormones, testosterone in males and estrogen and testosterone in females, which drives female sexual desire. Attraction, while related, is different in that when you are attracted to somebody, your brain will produce dopamine, which controls the reward behavior. It's released when you do things that you like spending time with loved ones, having sex, or eating cake. Another hormone that is released is norepinephrine. Both of these hormones make you feel giddy, energetic, and euphoric. When people see pictures of someone that they're strongly attracted to, the primary reward centers of the brain show intense activity on scans. Needless to say, you can lust for someone who you're attracted to, or you can feel one without the other.
You know, Dr. Lee, I'm glad you kind of defined lust as kind of, nature's way of making sure that, we continue to procreate. So it's not a bad thing to feel lust sometimes.
Oh, yeah.
Yeah. Well, how about the dreaded friend zone?
Well, we're talking about the friend zone. We're talking about attachment. Whether a friendship, parent-to-infant bonding, or other long-term relationship, there are hormones that are released that help us bond with others. The 2 hormones that are the main ones are oxytocin and vasopressin. Oxytocin is known as that cuddle hormone and is released in large quantities during sex, breastfeeding, and childbirth. It also affects other social interactions, including trust and recognition. Attachment produces feelings of calm, security, social, and emotional comfort.
Thank you for that. A woman says, does sex have anything to do with breast pain?
Well, during your menstrual cycle, you may experience breast pain due to increases or decreases in hormone levels. This usually happens between the 2 weeks before ovulation and your period. This is normal and not serious. You could also be having pain if you're in the early stages of pregnancy. The pain may also be caused if your partner is paying too much attention to your breasts during foreplay. Friction can irritate the sensitive skin around your nipples and cause soreness.
So again, communication, if you're spending too much time on the breast, maybe say, hey, stop it, or take a break, go down farther south. What can they do?
Well, here are some things you can do to get relief. Try an over-the-counter pain medication or use a warm compress. Also, make sure your bra fits perfectly so that there's no added movement that could cause friction and irritation. You could also try over-the-counter primrose oil. Some studies show that it reduces nipple sensitivity.
Primrose oil, okay. Could that pain be bad?
Well, most nipple pain or soreness is not serious, but you should check with your doctor if the pain doesn't go away or if it gets worse. You have nipple discharge, also reason to go to the doctor, or if you feel a lump or a mass in your breast.
Still to come on Sex Talk. Managing genital odor. Male fertility issues. All about pheromones.
Dealing with body odors is no fun, especially when it's coming from your penis or vagina. We have some tips to help you manage those unwanted odors.
While it is natural for the genital area to have a unique scent, excessive or unpleasant odor can cause discomfort and embarrassment. There are some ways to lessen odors in this area. Keep the area clean and wash daily. Wash the genital area gently with warm water and a mild, fragrance-free cleanser. Avoid using harsh soaps or douches, as they can disrupt the natural balance of vaginal flora and potentially worsen odor. Thoroughly dry the genital area after bathing or using the restroom. Moisture can contribute to the growth of odor-causing bacteria, so ensuring the area is dry can help reduce unwanted odor. Not only should you make sure to use clean underwear, opt for breathable fabrics such as cotton to promote air circulation and minimize moisture buildup. This is also true when choosing workout gear and clothes in general. Sometimes loose-fitting clothing can be better. And don't underestimate your diet and hydration. While both contribute to good overall health, also consider avoiding strong-smelling foods like garlic, onions, and spicy dishes. As with any health concern, talk to your doctor for further guidance and to rule out any other medical conditions.
There are a lot of products out there that can help, but be careful what you're using because it could lead to more issues. Still to come, a doctor shares the main causes of infertility. Plus, can CBD gummies help with ED? That's next.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about Sex Talk. Go to askdrleah.com.
Welcome back to Sex Talk. Today we have men's sexual health expert who is Chief of Urology at Baptist Health, South Florida, Dr. Daniel Martinez. Thank you so much for joining us.
Thank you for having me.
So we're here to talk about infertility. How do most men find out they're infertile?
Well, unfortunately, most men find out they're infertile when it's too late. Usually they and their partners are trying to have natural pregnancy. And along the lines, it ain't happening. Usually the woman goes to get checked out first. And something along the lines triggers, hey, let's check your husband or your partner's semen analysis. And boom, that's typically how they find out. Occasionally I'll have somebody show up because they have a history, potentially of some urologic issue, but it's usually after the fact when they realize, wow, I can't get her pregnant.
So we know there's a wide range of different fertility concerns. What's the most common?
Well, the most common infertility situation is actually one that's created by us, which is vasectomies. Vasectomy is a procedure that we do to cut the actual tube that brings the sperm into the ejaculate. We do that usually when a guy is done having children, so that's the most common. Other than that, we will see some mild abnormalities more commonly in the semen analysis. You know, a man is allowed A man can have the ability to father a child well until they die. It's not like a woman when they hit menopause and their ovarian reserve just gives out. But over time, you're going to notice a change in the decline in the number and the quality of the sperm, which is probably the second most common situation. Then we'll see guys who come in and they got either really, 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 really low sperm counts or no sperm count whatsoever. That's called azoospermia or oligospermia.
So you mentioned vasectomies. How successful are vasectomy reversals?
That's kind of a loaded question. In the right setting, they're a very high success rate, 80 to 90%. We typically look at the age of the patient. We look at how long it's been since the vasectomy was done. So we want to look at a vasectomy age range less than 10 years. We want to know the other history. Have they been on steroids or anabolic steroids or testosterone, certain things that will shut down their own intrinsic production of sperm. And we look at the partner. Is the partner advanced maternal age? Does the partner have some sort of abnormality that may hinder her ability to be able to have a natural conception? Because it's not just get the guy's tubes reconnected where sperm's going through, it's getting them pregnant.
So aside from vasectomies, how treatable is male infertility? It's
very treatable. Again, it's one of these taboo things where everybody thinks, oh, if they can't get pregnant, there must be a female factor only. It's fairly common to see men have issues with being able to get somebody pregnant. And we have an array of things that we can offer, from pills, from shots, from certain surgeries beyond just a vasectomy reversal that will allow us to be able to either obtain sperm or harvest sperm to be able to use for assisted reproduction.
All right. Well, thanks, Danny. Stay with us because we'll be right back with more Sex Talk.
Still ahead on Sex Talk. What's the cause of a sex discharge? Can the size or shape of testicles change? All about pheromones. How sex can affect your cycle.
Back here on Sex Talk, let's take some more questions from our viewers.
Dr. Leah, a woman says, whenever I have sex, it's an absolute mess to clean up because of me and watery discharge. Is this normal?
Well, just about every woman produces vaginal discharge, some more than others. And in most cases, it's normal unless you have other symptoms that don't seem ordinary. So when you're aroused, your vagina is producing discharge. Somewhere between 1 and 4 milliliters is considered normal. Vaginal wetness helps the vagina keep clean and it protects it from tearing and other injury during sex.
Okay, what exactly is vaginal wetness?
Well, vaginal fluids are mostly made up of water, some salts, and organic compounds like amino acids and antibodies that help reduce the risk of infections. Vaginal fluid typically lines the vaginal walls and provides lubrication that makes having sex more comfortable. Factors like age, hormonal levels, medication, stress, and level of arousal, and even perspiration can affect vaginal wetness.
So you're saying it can happen anytime, but mostly during sex, right?
Well, yeah, when you're aroused, your blood flow increases to your genitals, causing a release of fluid from the cervix and from the Bartholomew glands, which are on either sides of the lips of the vagina. The more you're aroused, the more your body fluid will release.
And what are the Bartholomew glands?
Bartholomew glands. The Bartholomew glands are a pair of pea-sized glands found just behind either side of the lips that surround the entrance of the vagina. They're kind of on the lower part. The glands are not usually noticeable because they're rarely larger than 1 centimeter.
So is this discharge the same as squirting?
Well, squirting is a term that's used to describe when a female releases a type of fluid from the urethra or vulva area when sexually stimulated. The fluid is usually clear, odorless, and sometimes can come out in large quantities. Female ejaculation is a term used when a female releases another type of fluid in a small amount, which is usually milky and white. There's different thoughts about squirting on female ejaculation. Some say squirting is just urine, while others say it's a different fluid. But there was actually an article in Discover magazine where pelvic ultrasound scans were performed after voluntary urination and during sexual stimulation just before and after squirting. Urea, or creatinine, uric acid, and prostate-specific antigen, PSA, concentrations were assessed in urinary samples before sexual stimulation, after squirting, and the squirting sample itself. Yeah, someone actually collected that. All participants did show bladder emptiness and showed noticeable bladder filling just before squirting. Just after squirting, the bladder had been emptied again. However, PSA was not detected in the urine sample before squirting, but was present in the urine after squirting, as well as the squirting sample itself, indicating that the fluid that is being squirted is definitely different than just urine. The prostate-specific antigen is created in a gland that's similar to the prostate, but in women it's called the Skene gland. So it's possible that when PSA collects in the bladder and when it gets expelled, it mixes with whatever urine is in the bladder at that time.
Whoever thought squirting could be so complicated. So, so it's the creatine that you use before you work out? No.
Well, so creatine that you think of that you're using or supplementing before, even after a workout, you can supplement it. It's nice, cheap, it's great. I recommend it as an exercise physiologist. But that compound is actually naturally produced by the kidneys and liver, and you could also get that from your diet. So foods like beef, seafood. Creatinine is a waste product of creatine that is formed in the skeletal muscles for normal muscle metabolism. But creatine is absolutely wonderful for not only your muscles, but also brain function. And when people who had major brain injuries, when they supplemented creatine, they were more likely to recover from them. So creatine is the supplement, if I had to pick one, that I'd recommend over all else.
So any advice for dealing with the mess? I know they sell certain sheets for that, correct?
I mean, are you talking about the plastic covers that you cover your child's bed with? I mean, they do have like bedwetting sheets. I've never heard of like squirting sheets, but a towel works, anything like that. But there are certain positions that you're more likely to cause squirting. So some women might feel that more from the hand or fingers, or some people might find it more for anal. So you could avoid that if it's a problem, but a lot of people see it as a huge turn on. So why avoid it? Have fun.
Very good. Awesome. Next question. A man says, I've noticed a change in the size and shape of my testicles. Should I be concerned about this, and when should I seek medical attention?
You should check with your doctor if you notice a change in the size or shape of one or both of your testicles. If one feels heavier, changes shape, or you feel a lump in it, it could be a tumor or the first sign of testicular cancer. Getting an early diagnosis is important because this cancer can be treated successfully. It also could be a testicular torsion, where the testicle rotates, twisting the cord that brings blood to the scrotum. This can cause sudden and severe pain and swelling.
What should he know about self-exams?
Well, you should give yourself a self-exam monthly to check for lumps or other changes, just like women giving a breast exam. It's the same thing for men. So to do the exam, gently roll your testicles between your thumb and fingers, feeling for any lumps or changes in size. If you notice any pain, please see your doctor as soon as possible.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about sex talk. Go to AskDrLeah.com.
You may have heard of pheromone perfumes, a unique way to elicit attraction. But what exactly do pheromones do, and how much do they affect our bonds with others?
Pheromones are chemical signals released by animals and humans that trigger specific responses in others of the same species. With human sexuality, it is thought that pheromones play a significant role in signaling attraction and stimulating sexual responses. Studies have shown that certain pheromones, such as androstenol and androstenone, can enhance perceptions of attractiveness, trigger feelings of arousal, and increase sexual responsiveness. These chemical signals are believed to communicate important information about genetic compatibility, reproductive health, and overall fitness. One of the intriguing aspects of pheromones is their ability to exert their influence on an unconscious level. Sometimes people are drawn to each other without consciously understanding why. The market is flooded with products claiming to enhance sexual attraction through the use of pheromones. While the effectiveness of such products remains a topic of debate, it is important to note that naturally occurring pheromones are far more complex and nuanced than what can be bottled and sold.
There's still a lot of research that needs to be executed, especially when it comes to pheromones in humans. Now let's take on some more questions.
Beautiful, moving right along. A viewer says, my guy friend had a stroke and has diabetes. Now he has ED, but is worried about the price and side effects of meds. He likes oral, but I crave intercourse. Do you think, Dr. Leah, maybe the CBD gums may help, or perhaps another more safe option?
There are medications for erectile dysfunction that can cause side effects. Some of the common ones are headache, dizziness, nausea, and muscle aches. CBD is a compound made from the cannabis plant, and there is some evidence that it can help reduce anxiety, stress, and depression, which are conditions that can contribute to ED. A study found that CBD can help conditions like chronic pain, migraine, and arthritis, but there's no solid evidence that it can be used to treat the symptoms of ED. However, researchers are looking at whether cannabinoids can improve the symptoms of people with multiple sclerosis. If that pans out, the hope is that patients can avoid MS medications that lead to ED. Other studies are looking at how CBD helps with chronic stress and personality disorders, as they are risk factors for men to develop ED.
Dr. Leah, a woman writes, I've noticed a change in my menstrual cycle after starting a new sexual relationship. Can sexual activity affect my period, and should I be concerned?
Every woman's menstrual cycle can be different, and how it's affected by sex changes too. They actually did a study in the 70s where they found that participants who had regular intercourse had a cycle that lasted from 26 to 33 days. For those who had inconsistent intercourse, their cycle varied more widely, either being much shorter or much longer.
Maybe you and your colleagues can update that study. It's in the 70s.
Yeah, it's been a while.
Okay. Can sex and your menstrual cycle regulate each other?
Routine sexual activity changes certain hormone-based characteristics of the menstrual cycle that can affect your cycle. Your periods may become more predictable, and PMS symptoms like bloating and moodiness may lessen. After most women become sexually active, they do experience a slight change in their cycle, and many have seen improved menstrual symptoms, but only after reaching orgasm.
Okay. Our last question of the day, Dr. Leah. A man says, my wife has only been with me. I bought her a bigger sex toy for Mother's Day. Nice guy. Now she is obsessed with the size. She watches porn by herself, so I can't see what she watches. What should I do?
Well, first off, have you tried to talk to her about how you're feeling? Have a conversation and try to find out how she's using the vibrator. Don't think of it as a replacement for you. Many women can't climax with intercourse alone because their clitoris is not stimulated fully. So don't jump to any conclusions that she's trying to replace you with the vibrator. She may be experimenting with different ways to orgasm and be shy or embarrassed, which is why she might be watching porn by herself. Ask her if you can join her.
Dr. Leah, would you say the toy was a bad idea, or maybe he should have bought a smaller one?
Sex toys can be a great addition to the sexual experience. Suggest making the toy a part of your lovemaking and use it on her to get her fully aroused. Let her guide you and teach you how to use it by asking her what feels good. See if what you're doing is right, but don't jump to any conclusions. Why not look for a sex toy that you can both use as a couple? You can find them online or in a sex shop. It's important that you're open and non-judgmental when you talk about it.
Communication.
Absolutely. That's always what I say start with.
Absolutely.
Well, Derek, that's all the time we have for today, but you can still send in your questions. I'm Dr. Leah Janine, and we will see you next time when we answer the questions you've always wanted to ask on Sex Talk.